My name is Marcus Hills. It's January 20th, 2017, 2:05, and we're here at the Pennington Biomedical Research Center. I'm here to interview Dr. Stephanie Broyles. She received a bachelor's for zoology, master's for biostatistics, and PhD for biostatistics, correct?
You are right.
Okay, and the purpose of this interview is just getting a little bit more insight on you. Okay, and I understand your job title here at Pennington Biomedical Research Center, but can you guide me through your job specifications?
Sure. So I'm a kind of a public health researcher. We answer health questions, and so there's a bunch of different components to that. Part of what I do is write grants to get money to allow us to study things that answer these questions, and when we had the funding to do the research, we then made like design studies or programs to help kids. And it's really important that we also do proper measurements so that we can see if what we're doing is working. And then on the backside, once things are done, looking at the information that we've collected to see if what we've done has worked, and then getting that information out to other scientists and the public so that we're moving health in the right direction.
All right. What impact does your career have on the community?
I'd like to think that it helps make the world a better place, because that's kind of why I got into it. And I think one of the things that's a little hard about being in research is we don't always see like the direct effect. But I think an example of some work that I've done recently that it was good research, and it was also just felt really good, was the Play Streets program that I told you about. And although we're working for it to have a larger impact, just seeing the difference that it made and getting the feedback from the community members when we were out there was just so rewarding.
All right.
But I think, other big picture things, we continue to work with, say, the health department to look at where the problem areas in the state is, so that we can, again, kind of move health in the right direction.
Yeah, okay. All right. And why is impacting the community so important to you?
I think it's just kind of a part of who I am, and I think it's also why I went into this area of research that I did. Some people are driven maybe by intellectual curiosity. They like solving a puzzle, and I think that's part of why I do what I do. But for me, I have to be doing something that I feel like is making a difference, and that's what makes me feel good about what I do when I go home at night and stuff. If I don't have that, then all of the other stuff just isn't worth it. So
right, you have to have a real reason of why you're actually doing this.
Yeah. Okay. And I think you and I talked a little bit. Part of what I do as well is I teach. Right. I teach graduate level classes, and even before I got into this, I taught at the high school level. So I think I kind of gravitate toward professions where I feel like my work is making a difference.
So you have a passion to just make a difference in the world.
Yeah.
All right. And what was your favorite project and its outcome?
Well, I would say my favorite project recently, again, is that Play Streets program. Worked with the most incredible people in the community, worked with outstanding, leaders like, Councilwoman Ronnie Edwards, who has passed and is just such a loss. But, so many people that are kind of committed to the same thing, to making our communities stronger and safer, and letting kids be more physically active. And it was just a great project from start to finish. And we also really learned that what we did make a difference. So we learned some valuable things, but the whole experience was just fantastic.
I enjoyed the Play Streets also.
Yeah.
All right. How have your previous projects in total succeeded in making the change?
I think it's a little bit of like what I mentioned a few minutes ago, that sometimes it's hard to see the impact, like the specific impact of like, oh, I did this research and this has been like, the specific impact.
Right.
I think sometimes as a scientist, we see impact in terms of like you see almost like you're seeding conversations, if that makes sense. So some of the work that we did that makes the level of obesity in Louisiana makes it a little more high profile.
Right.
Some of the changes I see is that people are now talking about these sort of issues more. And my specific area of research, which is around how do we make our communities healthier? How do we change our communities so that it's easier for people to be healthy? These are things that people weren't really talking about a couple of years ago, and now they are. And I can't take all the credit for it. I mean, I think, Michelle Obama with her Let's Move initiative really elevated the conversation and almost created a platform for this kind of research to get a bigger voice. So,
sometimes it takes time, like it happens down the line.
Yeah.
Happens like just years later
Yeah.
that you actually see the change in the community.
yeah, exactly. Or almost just like there almost has to be like a critical mass of people have heard it enough and it's reached the right ears, and now, other people are kind of moving it forward. But, that also reminds me that, as a scientist, it's like I can only do so much. Like my work has to find like receptive people in the community or politicians to really kind of make my work have the most impact. Because I went into research because I'm really good at doing research, and I can analyze data and all that sort of stuff, and I can plan experiments. Other people's strengths are taking what I've learned and making people really care about it, and so it's fun to have those partnerships.
Right. Sometimes it takes a team.
Yeah, completely.
All right. What do the children of the community and their futures mean to you?
It's kind of like the question that you just asked. I mean, it's what gives my work meaning, and it kind of is just like it's the reason behind why I do what I do.
Just want to see the community healthier. I'm sorry, I have a lot of passion questions.
Yeah.
What are your next project plans?
Well, you and I just talked about this before the camera started rolling. Right now I'm applying for some funding from CDC, and we're working with partnering with Ag Extension and with the Health Department and some other researchers around Louisiana to start looking at, Louisiana. We all know about Louisiana's obesity epidemic, but
Correct.
What people don't necessarily realize is we're one of the worst states for diabetes as well. But even though we're one of the worst states for diabetes, we definitely have parishes that are a lot worse off and parishes that are a lot better off.
Correct.
And so the whole purpose of this project would be to say, what are the differences? Kind of what are what makes some parishes healthier places to live than others when we're talking about diabetes? And so if we can better understand some of those differences, I mean, you might have two parishes, they're both rural, they're both like high poverty, but in one of them, the diabetes rate is, say 16%, and the other one, it's, like 9%.
Mm-hmm.
What are those differences? Can we understand it, and can we use that information to bring down diabetes throughout the state? So again, it's like what I said at the beginning, one of the first steps is you have to kind of compete for the funding and convince CDC that this is the place that they should send it. But this would just be a fantastic project for our state and for all the work that we already have going on, to have this information to be able to make that difference.
I think it'd definitely be very beneficial.
Yeah, well, so I'll get a letter of support from you.
Yeah.
We'll send it in with the grant.
In what way will this project affect the community, which we kind of already just touched on?
Yeah, I mean, it not only does it answer kind of like an important kind of public health question, but we already are working with the health department on these sorts of things, and with Ag Extension and the Ag Center, and so it's like it's giving information to our partners that allow them to make their work even more impactful than it is. So yeah, we're all really excited about this potential.
I'm ready. I want to see it happen. Okay. What obstacles do you have to overcome, such as funding or cooperation in the community?
I would say that's one of the hardest ones, is that, I didn't get into this work. I got into this work because of the passion, but kind of the reality is it takes money to do this work. It's not like someone is just like paying me to do research and there's all this sort of thing. Every research project we do, we have to have convinced someone, whether it be the National Institutes of Health or CDC or kind of like American Diabetes Association, American Heart Association, we have to convince someone that this is a critical question that we need to study to, again, make our state, make our nation healthier. The fact is, we're competing against other scientists that feel just as passionately about their work, and God, I think the funding rate right now, at least for NIH grants, is like 10%. So think about every time you put all this work and passion into a grant, and such a small percentage of people actually get it funded. So
Right.
that's the frustration, is having this passion, working so hard on these proposals, and not necessarily always seeing them materialize.
All right.
And that's where the passion really you have to have that to keep pushing through
going,
all
to
the
keep doing
frustration.
it.
Yeah.
You just want to make the change.
Yeah.
What is your inspiration to get up daily and attempt to make selfless change in the world?
So, kind of like what we talked about a little while ago, there's frustrating days where you're just like, the grant got rejected or paper got rejected or whatever, and you think, why am I doing this? And for me, the answer has to be that I really believe in the work that I'm doing, and I really believe that it is making a difference. And at the same time too, I'm a naturally curious person, so I enjoy being able to ask these questions and answer them using these studies. So, but I think the thing that keeps me going is that feeling of I'm making a difference, and all it takes is one little moment where you have that that feeling that kind of keeps you going for
Yeah.
a little bit longer. And I mean, I have to say, Marcus, like, you're reaching out to me and you're finding my work on the web. It's like you're keeping me going.
You're
So
right.
it's all part of that. So thank you.
Well, thank you, and thanks for the interview.
Yeah.